We tell men to be strong, but never tell them how. Today we are breaking that silence. Behind every I am fine is a story. And today we are finally talking about it. Hello, everyone, and welcome to our Movember special podcast series, Beyond the Mustache. I am your host, Mayank Badhwar, and this month we are diving deep into all the conversations men often avoid: mental health, emotional well being, stress, addiction, sexual health, and everything in between. Movember is not just about growing mustaches, it's about growing awareness. And today's conversation is one of the most important ones. Joining me today is someone who works at the very intersection of men's emotion, stress, addiction, and mental wellness. Dr. Naveen Kumar Dhagudu, Senior Consultant Psychiatrist at Yashoda Hospitals, Hyderabad. With advanced training in addiction psychiatry and 17 years of clinical expertise, he has treated thousands of men dealing with emotional suppression, coping struggles, addiction, anxiety, depression, and stress related disorders. Welcome, Dr. Naveen.
Thank you, Mayank, for nice introduction.
Yeah. So, sir, let's begin with something we see everywhere but rarely discuss. So, I'll start with my first question. Despite growing awareness, men still hesitate to talk about their emotional struggles. Why do you think emotional suppression has become such a silent crisis among men today?
Yes, Mayank. So just now in 19th of this November, we have celebrated International Men's Awareness Day regarding the untalkable, suppressible silence things are there, which we need to speak up now. This emotional suppression is not the new one in this era. It's primarily essentially rooted from the social and cultural influences on our families, especially male expectations in the families. From childhood onwards, they are the rearing up. Boys should not cry in the schools, in the families. That notion make them to the emotionally. It's not a stopping. It's a suppression. Okay, it's almost all we are socially numbing. So person finding the acknowledging the difficulties of emotion, even though he acknowledges his processing of emotions are very least options he have. So eventually the child, especially boys time onwards, he started to experience I should be man up behavior, macho behavior. I have to show up to my family, my people. I should hold all type of range of emotions, especially negative emotions. I should not be just ventilate like a female how they are crying their way. So these type of expectations make them to the emotionally experience suppression, especially in even working area. When you started to work, even in the office also, you just observe that how many men he started to go into complaining. So if you complain more than times, the people will be see that are you crazy guy? Why you are complaining so much? Why you are not holding your emotions? All the
Yes.
technical things, stress things, these are the part and part of work only. You should not be emotionally such a vulnerable. So here, all the vulnerable emotions like some sort of stress, some sort of sadness, fear, insecurity, job related struggles, everything will be going to suppress here. So this suppression make them to the very much sometimes lead into chronic stress. Some little bit stress of the one moment it was not processed enough, and they are differently reacting also on their suppressed emotion because it's a internally suppressed, internally driven. Certain behavior will be manifest to the surface like a consciously their behavior will be altered. So how they have to show their suppressed emotion, it will lead into distorted manner like a anger frequently, showing irritation, aggression frequently. Sometimes they will be socially isolated. This social isolation will be ultimately lead into the loneliness in their personal life. Okay,
Yes.
all having of its own ramifications. Sometimes it will lead into unaddressable depressed sad mood for the prolonged period of time. So that will be the maladaptively they will be numb their emotion to reach out where the people share their activities with the friends and peer. They will be started to experience action oriented sharing activity like a consumption of alcohol, something taking of drugs. So these times, negative times, these negative suppressed emotion all lead into causing for their another more times of relapses, or sometimes it will be increase their consumption frequency pattern, so eventually lead into addiction problem furthermore. So definitely it's a men's crisis. If you not ventilate well enough, definitely it will lead into some sort of the frustrations and these things.
Yeah. So, sir, why do you think that men struggle more than women to openly acknowledge or talk about their emotional difficulties?
Yeah, men observing their struggles, they're also like I say mother gender, they will also experience the difficulties struggles in the from the education in itself, job finding difficulties, and role responsibility difficulties in the outside. Okay, some all sort of the roles they have to maintain with a stoic manner, with a man firmness manner. So always these things make them to hold, so not to ventilate, express emotion. These things, females especially, they have lot much of opportunity from the culturally sanctioned things. For example, I can say loss of a loved one in the family, maybe death or something may happen. Our culture is sanctioned. For a female, they used to hug their son, they used to hug their husband, they used to hug their father. So there are multiple options, sisters, female conversations. They used to instinctive level they have to ventilate with the weepings. So there the much opportunity is there to emotionally ventilate the what is the loss is happening, they share. But men for long period of time, they need not to cry, they have to do the other things also, they have to manage the things, they have to hold on things. So this is somewhere we have the lesser options to ventilate these things. Eventually these pent up the emotions maybe lead into simply social isolation, numbing, silencing, not talking well with the peoples, avoiding with the friends and families. Okay, sometimes they used to proxy spend more time in the working environment. Yesterday I have given one talk, which is what is the your most stressful time, how do you have to spend. He will say that when I spend more time in the family, I used to come my office place as early as possible. Means he's doing work more. So it's nothing but it's a work alcoholism is also is a one of the method to numbing their emotions or something as a ventilating things. And some people will be land into alcohol and something drugs also. So these are all the overall in nutshell. Yes, men's difficulties not enough to have the sharing, primarily rooted from the cultural and social sanctions of the taboos and stereotypies experiences for men's behavior, expectations. Second thing is the range of emotional literacy, especially I can say the word. All range of emotions should need to acknowledge, should need to communicate in the words manner, language using of language manner. So sometimes the asking the help is also they perceive as a weakness and their personality flaw or something weakness. Maybe somebody will be judge me about their if I'm asking the help, they will perceive me as a weak person, less talented person, less skilled person. This type of more cognitions will be leading to furthermore barrier for the asking the help. That's hampering their expressing of emotion also.
Okay. So, sir, I think as a male community, we have to come together. I think.
Yes, yes.
Yeah.
Now there are the platforms, especially NGO platform, online platforms. So they're the struggles which they are facing by the commonly, especially family environment because of the domestic violence acts. There are some of the cases we have those noticing also, like section 498A, where the this domestic violence act which is supposed to protect the female suppression activities, especially their paternalistic society like India or something any other world. So these policy related, act related some things misused by the some educated peoples. So they will be misused about that for the law protection, financial gains, some sort of the relational opportunities. They misuse these things like for section 498. They will be started to struggling emotionally, morally, financially also. Okay, so they will be drained out sometimes, not all times, no? So we have to go with the contest based, issue based, person based things.
Okay.
Second thing is, yes, supportive men's supportive activities. Especially important thing is the men's issues are supposed to be aware and addressed. Like I can say men's psychological issues like anger, aggression tendencies which they are expressing out of their silencing emotions they are experiencing. There never be weep, never be say sad something there. People will be expressed through the anger. This way, this should not be equate like a personality. He is like that man only, and sometimes he's just it's a momentum, temper tantrums he is showing. So, out of the frustration, stress, he is showing stress. No, sometimes persistent negative emotion he is expressing like anger, irritability. Maybe it's a mask of the clinical depression. Okay,
Okay.
that should. If you neglect in early stages, maybe it will be this helplessness, loneliness leading to escalate to hopelessness level, suicidal level. So, some it leading to sometimes irreversible consequences also. So, depression, early finding of depression, especially in men's. Why I am telling you? See, compared in statistic data also saying that 4 times more men are committing suicide, successfully suicides, than the female gender. Means the problems are really struggle. Men silences are really harming the society enormously. Okay, so even that over representing of the substance use problem in the male, especially why? Maybe this is one of the reasons for that their adequately mental health issues are not addressed. It's also one of the marker we are seeing more
Yeah.
and more. So like this, we have to take care about the men's issues in this platform, create awareness. You are doing wonderful job, this man, with these things also. Thank you.
Thank you, sir. So, sir, I'll move on to my next question. Like
Yeah.
many men struggle to express emotion even with their partners. So,
Ah,
why does this happen, and how can couples improve communication?
yeah. See, in the marriage system itself, we perceive that male should be independent, male should be so stoic, male should be strong enough to handle all the stresses and safety issues of the family. Okay, so male should be the productive enough. Okay, these type of the stereotypes will be there in the this modern, even though modern society like India. So this role responsibility make them to that lesser expression of their vulnerable emotions also, where they are having of pent up of their stresses, where they are feeling the overwhelming experiences, they are unable to share much enough. They simply office related the work pressures or something home related pressures, they will be try to manifest through the behavior. They always wanting men will be show more with the action oriented rather than the emotions oriented. So they feel that more and more avoiding or something showing aggression, some sort of the verbal aggressions, anger outbursts. So these are the proxy marker for that. So people will be perceived that underlying depression, underlying stress, they'll be misidentify something. And especially in females, especially partner times, we need to improve the communication, especially open manner, emotional discussion manner, rather than using that I never, you never talk with me because I'm already fed up with your opinions, all these things. If you say like that, there is a not possible to emotional exchange, communications happen. So always be open discussion for the emotions. Like I am observing too tired in the couple of the days. Maybe something has happened. If you open these type of these things, they will be ready to discuss their inner struggles. They are ready to express their emotions also. So this type of open communication in the family, trustworthy people, especially spouses, we have to open these things. Second thing is create a safe space to especially improving the communication between the couples. You have to create a safe space to express their inner struggles. Need not be too judgmental, need not be too critical comment passer. So let me actively listen. Let me make them to the yes, my stories, my struggles. On my foot of experiences, he is understanding my emotions. That type of empathy, if you gain, yes, the deeper connection will be formed. And
Yes.
try to take some break times also, personal times also require, especially for to resolving processing their emotions. So don't be too clingy in the families when the heated environment times, in the heated emotion times, still they wanted to fix out all the problems at this moment. Maybe not. Sometimes the open discussion, asking for the help, this is the first step to resolve the issues also.
Okay.
So this type of
Uh,
environment should need to create.
okay. So, sir, what are some early signs of depression in men that families often miss? Like, how can we recognize that the person is going through something or he is depressed? How can we recognize that?
Yeah, very good question. I can say it's certain warning signs or red flags in the men's behavior. Your spouse, your son, or your father or your brother is posing persistently some sort of negative emotions. They are posing rather than telling the directly stories. Just they are anger outbursts are more and more, isolating so much, not attending the work. He will be started to saying that some sort of meaningless of my work, meaningless of my presence. If I am not there, then you people are all happy. These type of sentences are actually is a proxy markers of their helplessness state. Second thing is they are starting too much of alcohol binges more and more, increasing their frequency of consumption of alcohol or tobacco more and more, any drugs, and their recklessness behavior is showing more, and they are finding the difficulty in sleep, which is the usual times is 6 to 8 hours or 9 hours of sleep he's going, but this time he's wake up 2 hours earlier than the previous, or lying down on the bed even the mid of the afternoon times also he's lying on the bed. These type of fluctuations of sleep hours, even that is showing participation or interest in the hobbies which he is having of previous, like a paper watching, tv watching, the you know what's called podcast, all these things, he's so passionate. So when he misses all these things, something is saying some sort of anhedonia like this way, or else I can say it's a uh, socially avoidance is a sort of increasing there the loneliness, though he's not wanting for that, but because of the socially not possible to expressing his emotion and he's stucking with the emotion, he's not ventilating well enough, then he's starting the isolating. So enough, he's not having of self-care practices. People will be sometimes they have to express some gratitude, self-compassionate work also. He is finding difficult to acknowledge his own emotion, then how can he practices also? So this type
Yes.
of struggles I'm seeing actually.
Okay. So, sir, as a man, you must have heard it. I have heard it. So, there is a cultural narrative of men don't cry
Yeah.
and be strong. So, how harmful is this when it comes to mental health?
Yeah, when we heard this type of phrases, men or boys don't cry. Okay, should not be so vulnerable like this way. Huh? So if you say if you heard this type of phrases, it's a harming on the person, harming on the society, very enormous manner. I can say in statistical terms also. Okay, see, if you holding your emotion slowly, it's a retrogradely, it's a hurted your soul, and it will be trying to ventilate, coming to surface through the retrograde emotions. You are feeling actually innerly you are feeling sad, feeling alone, but outside you are whatever the people are there, your spouses and peoples and kids, we are showing anger on them, you are outbursting on them. Okay, you are showing persistent violent aggression also sometimes. If you show like this type of behavior, so enormous its effect on the family, it's a productivity also affect, your work life balance will be affected, eventually your work tentative dates or schedules will be procrastinate more and more, you are not able to focus also. So these persistent focus disturbances lead into again psychologically mental health conditions like anxiety, depressions. Okay, and not but not least, I can say these phrases make them to the society very harmful manner. The evidence I can say eight eight times of suicide attempts in men, one will be successful attempt will be happen. Okay, whereas the female 40 times they do before doing successful attempt. Humans means that much of inner drive, action oriented solution they wanted to find more. So here, what I'm telling is, rather than the always thinking in the problem solution manner, okay, always we have to hold a embracing your vulnerabilities. You have to accept. You have to ventilate. Sometimes honest communication, open communication, and expressing your wherever the difficulties, wherever the wrong things are committed, we have to put on the table to discussion. It's always healthy. Sometimes just it's a small step, but it's a significant step in the recovery also. Okay, so
Yes.
this type of things we have to keep in mind.
Okay. So, sir, how can society make it easier for men to seek psychiatric or psychological help without any fear of stigma? Like going to a psychiatrist today as well, it is found out that you are a weak person. So, how
Yes,
can a society make it easier for men, like, to
yes,
seek
yes.
psychiatric help?
True, true. See, I can say it's this question into two form. When to meet to a psychiatrist. Okay. So
Okay.
how to meet to a psychiatrist? These two things.
Okay.
Okay. So when to meet a psychiatrist means when you are having of struggles are persistently happening, like a just now I have told no. So your anger, sometimes of frustrations, substance use are increasing more and persistently. It changes happen. Sleep disturbances, energy getting drained, lack of motivation in the work, your work, some sort of overworking as a proxy for the avoiding of your things. Okay, these are the things that persistently happen, and the expressing of the negative thoughts and negative beliefs regarding the future, regarding the present work also, and frequently you are getting the inviting the troubles in the within the home and outside the home also, and lacking something, finding so much of struggle in finding the concentration on the work, all these things, and hopelessness idea, extreme socializations are happening. So then you have to, yes, definitely asking the help is a courageous act, not a weakness. When your
Yes.
time is demanding for you to seek help, don't be hesitate, because
Yes.
life is a irreversible. You have to be kind enough to your own self rather than other persons. How
Yes.
kindness you have to express when I am the having of some of the skills that not have, some of the strength I have, but I am having of facing some big troubles in these times, you have to accept it. My abilities, my struggles are now is a very big time, I am unable to handle. Can you extend your hand, help of something, suggestion, something extending of your time, devotions? If you say like that, maybe it's a very open to other person also ready to give some sort of help also. And second thing I can say, how we have to approach a psychiatrist. Yes, of course, we have to go with the culture and society. Yes, stigma is there. It's there. We have to accept. Yes, we have to try to find hardly to break the stigma, but it's there prevailing things. People perceive to say I'm sad means they perceive the people will understand very weak personality I have. So always you have to whatever the somatic symptom, they are better to happy to reach to physicians. Okay, then any headaches, any stomach aches, any body pains, any sleep disturbances, any sort of the having of presented problems, there is a easy to go reach to your nearby the primary physician or physicians. Okay, then they take the proper referral after the ruling out of all the medical problems. Then psychological, psychiatrical neuroscience will be maybe better suited person to address these issues. Because as a cardiologist, as a physician, I can see where the BP or blood pressure, something, diabetes, heart, lungs, maybe these are the functioning well, but these functions are decided by the neurons connection. Maybe psychiatric neuroscience better the expert to reach these answers. Why not you consult with them? Why not you take the help? This type of informed suggestions well well informed suggestions, less stigmatizing suggestions make them to comfortable. Like reaching a cancer specialist when you have finding the tumor is not a weakness, na? It's a
Yeah.
intelligence, so
Yes.
intelligent attempt also, because early stages finding cancer is always better. Same thing, either depression, whether anxiety, whether addiction, whether it's a psychosis, okay, whatever it may be. Even simply your concentration difficulty, sleep difficulty, emotional ventilating difficulties, you find better to reach in early stage to nearby psychiatrist. They will guide you
Yes.
simple evidence-based medication. They will be offering you some suggestions also. Okay, as per the science manner, they have to treat you also. Need not to stigmatize. Like in
Okay.
our older days, psychiatrist means they are the like a witchcraft practices. They are the doing
Yeah.
something uh, black magic practices. That's not the previous. Now this is the current generation psychiatric neuroscience. It's a MBBS medical science only. MBBS, MD, even DM also there. So like a
Okay.
cardiology, neurology, oncologist,
Yeah.
like that. Don't be stigmatized.
So, sir, I'll move on to my next segment, which is the rapid fire round. So, I'll
Yeah.
ask short questions and would request you to give very short and lively answers.
Yeah, let me try.
So, sir, one emotion men express the least but feels the most.
I can say vulnerable emotions for men. Men doesn't accept vulnerabilities. Always they wanted to show strength, courage on these things. So vulnerable emotions are very easy to hide, difficult to find also, and they are practically they are experiencing more and more than the female. Like what are that? They are the vulnerable emotions like is a free anger, sadness. Okay, these type of emotions they are facing very highly.
Okay. So, what's the biggest red flag in men's behavior that people often ignore?
Yeah, I can say biggest red flag is the persistent aggression, anger outburst. I can say next thing is recently started substance use or increasing their substance use. After a couple
Okay.
of period of the time, he stopped the alcohol and quit. He already quit, but recently again he started. Something is a red flag for him. Is
Yes.
unaddressable. Some psychological sufferings, social sufferings are going on. And second thing I can say, it's a, he's a frequently finding sleep disturbances, hobbies participations are drastically changed, social isolations, is not talking with the in the office environment, isolating more, look tired much, more fussy. So these type of the things are, I can say, it's a red flags to identify psychological troubles.
Okay. So, what's more dangerous for men, stress or silence?
Oh, very good question. Stress and silence both are very interlinked and interconnected. Okay, but silence is more dangerous because if you stress, things are needed to silently you have maintained. It will be leading to this stress, though even though it's a manageable level, because of your silence, you are not asking for the help. You are not expressing your stress where you are getting actually. You are not reaching to you how the best method of ventilation, make emotionally either crying, emotionally sharing your story, or some sort of the expressing the your helplessness conditions. So these things are silence make you barrier for the treat asking for the help, barriers for the treating getting the treatment from the expert like a psychiatrist. Okay, silence make you suffer most harder, and it will be pent up more and more. You will be increase your addictions, or you will be increased to more and more depressions, eventually sometimes suicidal ideations also. So silence is a bigger one.
Okay. So, sir, one thing you wish every man knew about therapy.
Oh, see, therapy, when the times are required, when the times are demanding for you to some sort of help is required, hand is required, some whether problem method, whether it's a stressful situation. But asking for the these type of therapies, like whether it's a supportive suggestions or counselings or medications, whatever it may be. So when the times are contextually, it's a depend upon that whether how much you are suffering, how long you are suffering, and what are the your resilience to come out from the these troubles. These are all things are make them to the yes, he is eligible if at all required. Asking for the help is not a weakness. Asking for the help is always the courageous act, the best act. Okay, it's a wisdom act also. So therapies are essentially for the men, definitely.
Okay. So, sir, this is my last question for this session. If a man watching this feels overwhelmed but is afraid to ask for help, what would you tell him directly?
See, first of all, we have to open the discussion conversation with a non-stigmatizing ones. So rather than you can say directly you are depressed, directly you are you are looks anxious. Don't be use this type of the word, maybe because if he feel how he taken, we don't know. So that's why always take the symptoms what he is experiencing for the open conversation. You look tired in these days. I'm observing that. Is this something okay? You started this type of questions or something open discussions, whatever the observable you are observable for the prolonged period of time, what is the things you are noted, you have to put on the discussion table. Then the people will be started to share their story, why, when, what. This type of question lead into the better expressing their sufferings. Second thing is the, so asking the help, you have to just encourage them. So all problems will be need to fix by today. Are you expecting this level? Or we have to start the recovery, start the improvement will be step by step. So for that first initial step is the must and should asking the help of the either the within the family, outside the family. If not, they are not enough to right person to give the this type of the help, then the reach to expert healthcare, especially psychiatric experts. So these people are the ready to hear your story, empathetically understand, non-judgmentally they will be understand, and early stage they will be find out the problems and solutions also they will be designed according to your suffering. So overall, give a emergency some sort of plan B actions, that type of the services also. So make them to encourage plan according to whether financial plan, health plan, something you have to socially some troubles how their plan we have to require. So offer the range menu of options and let them to make them to options to give all range of emotions supposed to be safely happy. We have to ventilate express, nothing to wrong to say. So like that we have to encourage them.
Men are taught to be silent, but silence shouldn't cost them their mental health.
Okay, yeah.
Yeah.
Silence definitely mental health harming one.
Yes.
Mayank, I'm audible.
Yes, sir,
Little bit
you are.
glitchy there, technical glitchy there. Yeah, little bit, can you
Yeah.
repeat the question please?
Yes. So, sir, I'm moving to the conclusion. Thank you, Dr. Naveen, for such an important and eye-opening conversation.
Thanks a lot. It's a very immense habit for me to.
Yeah. So, men are taught to be.
Please, Mayank.
There was some glitch, I think, network glitch or something like that. Uh,
Please go ahead. Yeah.
yes.
Thank you.
So, thank you, sir, for this conversation. Thank you so much.
Thank you. Wonderful conversation, Dr. Mac, and wonderful audiences. I am thank you. If at all, if people are really feel that it's an opted topic and essential topic to supposed to get some address or require, please reach us to me also. Thank you.
Yeah, sure. Thank you, sir.